Susanna, you're here already? Oh, sorry, sorry.
It was crazy.
Sorry.
Where have you guys been? I've been here for 20 minutes studying.
Apparently it was.
Wait, what med are we doing though?
Dilaudid.
Dilaudid.
Yeah.
Okay.
See, I'm already thinking ahead of you.
Wait, what's the generic name for that?
Hydromorphone.
Hydromorphone.
So
Dilaudid.
it was first researched and synthesized in 1922 and brought to mass market in 1926. It was used in executions actually. The last one it was used in was 2014 for a
Hold
double
on,
murder.
Victor. I have a headache. I need something because this is just too much. Sorry. Go ahead. I'm sorry. I'm listening. Go ahead.
Okay.
Yeah. Hold on.
So, also too, took 2 hours to stop breathing for the guy. It's the number 10 most abused prescription drug. Every year, there's at least 14,000 deaths of Dilaudid overdoses in the U.S. alone. And the funny thing about it, though, was it's made from morphine, and doctors try to prescribe that as opposed to morphine because they think it's less addictive, but as an alternative. But it's 10 times more powerful when used recreationally than morphine. And especially, too, if you mix it with alcohol or other drugs, it's very deadly. So that's where the overdoses come from.
Okay.
It's an opioid analgesic, and it's a class 2 controlled substance, so it's...
A few moments later.
So, who's doing action?
Oh, that's me. Let me see. What I got for action and therapeutic effect. Well, I see here it says it inhibits ascending pain pathways into the central nervous system. It increases the pain threshold, so it alters the pain perception. What do you guys have? Is that what yours says also?
Yeah. Well, there's side effects. Maybe you could go by that. There's the frequent ones are drowsiness, dizziness, hypotension, decreased appetite, and then occasionally confusion, diaphoresis, facial flushing, urinary retention, constipation, dry mouth, nausea, vomiting, headaches. Are you okay, Diana?
Yeah, I'm fine. Sorry. I was listening.
Who has precautions and contraindications?
Hey, it's your turn.
If you're pregnant, breastfeeding, if your child is less than 18 years of age, if you have renal or hepatic disease, adrenal insufficiency, abrupt discontinuation, asthma, angina, biliary tract disease, seizure disorders, bladder obstruction, hypothyroidism, hypovolemia, hypoxemia, IBUs, labor, latex hypersensitivity, or sleep apnea. Contraindications of this medication. Hypersensitivity to the product is 1. COPD, emphysema, GI obstruction, or high intracranial pressure, as well as obstetric delivery.
Drug interactions. It could increase effects. Yes. Oh, sorry.
You okay?
Yeah, I'm fine.
All right, let's get back to this. Interactions.
Yes. Increases effects. Other central nervous system depressants, alcohol, opiates. So antipsychotic. I think it's so hot in here. You guys are lying. The heater is on.
Just don't put the Nelly song on, please.
He said it's getting hot in here. What's wrong with you? We're dancing. We're in the club. I'm sorry. Okay, let me get back to the drug interactions. Respiratory. It increases respiratory depression. So basically, you don't want to take this medication if you have like trouble breathing, if you're allergic to like morphine. Let's see, what else did I find here? If you're pregnant, obviously, breastfeeding, you don't want to take this medication. You go ahead and nothing pretty. Oh, mine's pretty. Alcoholic shouldn't be taking it. Acute asthma, obstructive airways. So,
Hold on. Dana, what did you take for your headache?
I don't know. I took it to the mirror. It's for my house.
Here's your water because you're so hot.
Yes, it's hot. You guys aren't hot, Susanna?
No.
Like freezing.
Rosana.
Oh, Rosa. That's Susana. Oh.
How do you mistake different
Yeah.
people?
I thought you were Susana.
Dude.
I'm the only guy here.
I think she took Dilaudid.
What?
Oh, God.
Diana,
It's hot.
what'd you take?
No wonder you're acting
Pain
so loopy.
medicine.
Whoa.
Headache medicine.
This is
I take
Dilaudid.
Motrin.
How do you mistake
this
that?
is Dilaudid.
Yeah,
How'd
you're
you
supposed to get a
mistake it?
prescription for that.
I did. It was in my house.
Whoa, man, someone's gonna have
Oh
a
my
good Friday,
God.
apparently.
I don't know.
It's-
You're just.
Oh, God, it's hot in here. Aren't you hot?
No.
No.
I'm so hot.
The only one.
One eternity later.
So, how much do you think she took? Where's the bottle at?
Let me grab it.
Yeah, because apparently the oral solution for PO is 2.5 to 10 milligrams, Q 3 to 6 hours.
For tabs, it's 2 to 4 milligrams every 4 to 6 hours.
Geriatric, it's by mouth, 1 to 2 milligrams every 4 to 6 hours. But she's not geriatric, so I don't know.
Huh. Yeah. Well, doesn't look like she took more than what she's supposed to. But looks like most of the time this drug is administered through IV. So and it's a lot stronger of a dose because it's not really absorbed too strong orally. So we don't have to really worry about that there. But we should definitely get her checked out.
I agree.
Nursing considerations. Things to look for are monitor vital signs, assess for pain relief, instruct patient to request pain medication as needed for comfort. Patient teaching here is avoid alcohol, avoid tasks that require alertness, motor skills, changing in positions to be done slowly to avoid orthostatic hypotension. Do not chew, crush, dissolve, or divide extended release tabs.
In case someone overdoses, they can use Narcan 0.2 milligrams to 0.8 milligrams via IV, O2, lots of IV fluids, and vasopressors.